Let's switch the conversation from now until the end of the show to COVID-19 and how the country is handling and dealing with COVID-19 at present. Okay? So we know for a fact that we are in the third wave of COVID-19. We are seeing for a fact that there are very many more people who are requiring hospitalization now. If you compare this to the first wave or the second wave of COVID-19, the number of people who are dying in a day is also quite high. How many died yesterday?
25.
25 reported dead
Reported death yesterday.
And the number of people who are in ICUs around the country is more than 120.
Yes.
In ICUs around the country.
The number we're looking at yesterday was 124.
There you go.
Yeah.
124 people in ICUs around the country. Others seeking HDUs. Now, if we look at what we know as our bed capacity in the country, in the counties, as of May 2020, the country had 209 ICU beds in 42 counties. By this time, several counties have reported, because of COVID-19, they put in some effort, they did something, they got some money from the national government, they allocated some of their budgets to increase their bed capacity. They say that they have 493 ICU beds in the 42 counties. However, like we've heard from doctors, there could be ICU beds, but are they well equipped? And do they have the staff that are required to actually run these ICU facilities? So these are questions that have actually come up. So yes, you're talking about extra ICU beds, but do you have the healthcare workers who are trained to work in an ICU and to deal with ICU cases? That is an issue. Now, as we speak, we are seeing the Council of Governors coming out to say, yes, we are going on with the vaccination exercise, and that's another conversation we'll have. But at the same time, let's take care of what we are doing to deal with COVID-19. The primary measures that you need to do: make sure that you avoid social distancing, physical distancing. Try as much as possible, sanitize as often as possible, mask up as much as possible. Yesterday, there was a tweet by Governor Dr. Alfred Mutua, who was talking about the situation in his Machakos County. And he said, look, from what we are seeing, the situation is actually getting dire. And this is what he said. He said, Nikubaya, and that was his first message. All our Machakos level 5 hospitals, 15 ICU beds, and additional 12 HDU beds, that makes a total of 27, are full with severe COVID patients. All the Machakos 42 ICU and HDU beds with oxygen points are also full. People are waiting for others to die to get a bed. Mask up, avoid bars and social places. Be wise. Hakuna vitanda. My core message is that things are getting worse in Kenya. Machakos, as the leading county in healthcare due to our work, is starting to get strained. Those with ears will hear, and those who don't have will ignore the reality on the ground. Your life is yours. Jichagulie. This is what the governor was saying. And of course, there was a lot of reaction on social media. Some people saying, yes, it's true. Yesterday, we even saw a story carried by the Standard talking about the same thing that's happening in Machakos County. And we have seen other stories and other cases from other counties, especially the bedroom counties of Nairobi. We're talking about Nairobi, Machakos, Kajiado, Kiambu. They have been hard hit. People are looking for hospital bed. You don't get a hospital bed in Nairobi. The healthcare workers there call their friends and their colleagues from other hospitals around the county and other counties, and they get a bed, and you're told now you have to transfer your patient to that other facility. And that is when you're lucky. In many cases, people are not getting that lucky.
Absolutely.
What's the situation on the ground, and how did we get here? We have Dr. Alfred Mutua joining us on the line now. Good morning, Governor.
Good morning, Eric. Good morning. I'm glad to be here.
Good to have you on the show. Asante sana for speaking to us. What you said yesterday on that tweet message, you basically decided to come out and put the situation down as it is, saying, I don't have the capacity to deal with a rising number of cases that are being referred to hospitals in my county. Why did you decide to do that?
Well, we had a meeting the previous day with the Council of Governors where we discussed the dire situation in the country. And then I looked around and I realized that there's a sense of apathy in our community. People are not taking this third wave seriously. You look at what has happened in countries like Germany that have had a lockdown for like 3-4 months now. You look at France, you look at the UK, where they've even now restricted leisure travel. You can't leave the UK unless it's for medical grounds or of an emergency. You can't just travel. You look at what's happening in South Africa. And then you look at the numbers that are rising in Kenya. We've lost colleagues. We've lost friends. And when I sit down and I look at the numbers, our positivity rate was 1% in November, 2% in November, December. Now you look, we are up to 22%. Something is wrong. We are back to where we were last March. And incidentally, if you remember last March, around the same time, it's when President Uhuru said, no state travel, no travel for state officers, lockdown. It was March last year, about the same time. So a year later, we are suffering the same consequences. You look at what happened in Rwanda then, what is happening now, and then I've seen a laissez-faire because people really are removed from reality. Unless you have a relative or a friend who is dying, people have gone back to, you go to bars, you go to churches, you go to supermarkets, you go to birthday parties left, right, and center, markets. We are back to where we were, and people are starting to die in large numbers. And when I say people, I mean especially young men from the ages of 25 to 50.
So where is the problem as we're looking at it? Because from the message that you sent out yesterday, and which maybe even some would say it would have come even earlier, but all right, from the message that you sent out yesterday, there are two issues here. Is that one, a health system that is on its knees. That's a major problem that needs to be dealt with. At the same time, a population of people who are not taking this thing seriously, are not doing what they can to make sure that they are protected. Where do you think action needs to happen in order to get things sorted out?
I think it's very important for people to understand. I've seen some tweets and I don't want to be rude, but they are very simplistic. Because you can't just blame the national government, the county governments for lack of health facilities, etc., etc. When COVID came out, President Obama had a write-up, and he said very well, the problem is not provision of healthcare. The problem is healthcare getting overwhelmed. You don't need a lot of ICU beds in a country because usually very few people make it to the ICU and people survive and get out. So you find that hospitals usually have, you go 10, 15, 20, 80, big cosmopolitan. ICU, smaller places usually have 1 or 2 beds of ICU. You don't need a lot of ICU beds. However, if the systems get overwhelmed, and that's what COVID is doing, then you see the situation that happened in Italy, for example. You see the situation that is happening in Brazil. You see the situation that happened in New York City, whereby, yes, you've got the ICUs that under normal circumstances are enough, but now when you've got so many patients coming in for that disease, it becomes a problem. So I have to commend the national government. President Uhuru Kenyatta came out and said, let's ramp up our healthcare. We have the machines that have come in from that program of the national government. Some of governors like us, we've invested heavily. 35% of our budget has always gone to healthcare. We invested heavily on healthcare. We have the ambulances. We've built more hospitals, etc., etc. But the challenge is this end of ICU beds. An ICU bed costs between 6 to 10 million, depending on the quality. If you have good ones with everything, they're expensive. But what is more expensive is what Eric was talking about. You can have the beds, but do you have the personnel? Because in reality, what is needed, the good, the good scenario should be one nurse, for example, per patient. 24 hours, that means a nurse working in shifts, maybe 2 to 3 nurses taking care of one patient. That's an ICU nurse. An ICU nurse has to go for special training.
Training, sure.
So a bad case scenario is one nurse for 2 patients. Why are we in Kenya? We've got one nurse looking at 10 ICU patients. I mean, we're just, sorry about that, we're just basically killing our people because we just don't have the personnel. Now, whose problem is it that we don't have the personnel? Well, it's a third world phenomenon. We haven't been able to train enough healthcare workers. We've not had the budget to sustain the salaries of healthcare workers, and it's a challenge everywhere. If you go to the UAE, for example, They're importing labor. It is easy for you, if you're a nurse, for example, to get residency in Australia, or to be a citizen in England, or to be a citizen in North America or in Canada, if you are a nurse or a medical officer. Why? Because the world lacks qualified and available health workers. It's just a reality on the ground. So the issue is, let's not get to treatment. Let's stop this at prevention.
Sure, Dr. Mutua, I can definitely agree with you on that. But if we look at some of the specific issues that we are dealing with in the country, sure, what you did is that you gave a picture of Machakos and what that looks like. 15 ICU beds is actually one of the highest. Is actually one of the highest in the country. Right? If we're looking outside of Nairobi, is actually one of the highest. And if all of those are full, then there's a problem. But if we look at specific issues that some hospitals are dealing with, you might have an ICU bed, just like you've talked about, but you have no staff to man it. You might have an ICU bed or HDU unit, but you don't have oxygen. Are those problems that we really should be dealing with now, even if we have budget constraints and things like that? Should we really be dealing with something as menial as providing oxygen in a health facility today in Kenya, regardless of whether it's a third world phenomenon or not? Should we be dealing with a problem as basic as providing oxygen, having that available?
I concur with you. You know, provision of oxygen is not very simple, but it depends on the investment. We've really not, and let me tell you, the only president who's really invested in healthcare is President Uhuru Kenyatta. Uhuru Kenyatta has done quite a number of things wrong, like appoint some of the wrong people to deputize him and others. But one of the good things he's done right is invested heavily in healthcare. In Machakos, for example, and this is county by county, we decided to invest in healthcare. You know, the basics from just normal life-saving operations, like just getting the ambulances available for a 5 to 8 minute response across the county. We installed, our level 5 an oxygen plant. We provided oxygen tanks in our level 4 hospitals. We have piped oxygen. We have provided these beds and etc. These are things that should have been invested in that 24 years of Moi era. If we say the first 15 years of Jomo Kenyatta was trial and error. This should have been done 25 years ago and revamped with time. But healthcare has been neglected. When COVID came out, I said that COVID is an equalizer, because Kenya for a long time has been a class where healthcare is a status symbol. You fall sick, you have the money, you go to South Africa. You fall sick, you're taken to India. You fall sick, you're going to England or to America if you have the money. But what happens if you're poor? If you're from the village, you die. And then we say, we loved you, but God loved you more. No, it's nothing like that. God doesn't love the poor more. It's only because we've had a class system when it comes to healthcare. And this is a wake-up call to all of us as leaders in this country. Let us invest heavily in healthcare, but not only in provision of equipment, but let's also see what we can do to churn out our people who can actually be available to serve as nurses, as doctors. Currently, the salaries we pay doctors, currently the salaries we pay nurses, currently the salaries we pay our health workers are very high, not really sustainable from a management perspective. They are not sustainable. I mean, our doctors are paid at the same rate as doctors in New York City, as doctors in Washington, as doctors in the UK, as doctors in Australia, developed economies. Our doctors are paid nearly double what you pay doctors in a very good health system in Cuba, in Brazil, in other, countries that are more advanced in healthcare. So we'll have to find a balance. Either we allocate more to healthcare, we have to have austerity measures in other issues. But to me, healthcare is critical.
It's critical,
but it cannot just be a knee-jerk reaction that ongezeni vitanda. Unaongeza kitanda, who is the nurse taking care of that? Because it's not just a kitanda. They're the machines. There is equipment. I mean, there are those I think they're called CVC lines. You need an anesthetist to do that. In the entire country, we only have 75 of them to serve 42 million people, 45 million people, only 75 people. So you can increase these beds and they are lying there, but you don't have the personnel to actually hook up that line to save a life. So we also need a reality check in terms of a comprehensive health program.
Right. Dr. Mutua, in the last 1 year, and you've said very well, COVID started a year ago. In the last 1 year, there has been a lot of conversation at both the COG, the Council of Governors, with the national government, within the national government, on what needs to happen to at least prepare ourselves better as the situation unfolds. Now, where we are sitting today is we are seeing a number of people who need healthcare, who need that critical care, not being able to access it. Did we prepare adequately? 5 billion shillings allocated by the national government, extra amounts of money allocated by county governments. Where did all this money go if we're getting to a point where we're still looking at a shortage of HDU, ICU beds, or even isolation beds?
No, I think we prepared, and I think that's a realistic. We need to tell people we are way better than we were a year ago, and that's the reality.
How so?
I mean, in Machakos, when I got into Machakos, we had 0 ICU beds, 0 HDU beds. Within a few years, I had 6, and those were enough because we only had 2 people, 1 person in a week, 3 if you're busy, and we're able to revamp. I mean, I don't have 15. I have in the excess of close to 25 ICU beds. When you add HDU beds, I have 42. We have oxygen points up to 60. We have prepared. All the counties now have ICU beds. Counties do not have ICU beds. You only had ICU beds in the provincial hospitals, so-called provincial hospitals, level 6 hospitals, or the big level 5 hospitals. Now, every county in this country has ICU beds.
Can I interject here, Dr. Mutua? I'm sorry, but I've got to stop you because you can have the ICU bed, but if it's not functional, it's useless. And I think we've already agreed on that we can have a bed, but if you don't have somebody who's manning the bed, you don't have a scientist for the bed, it's useless. You can't use it. So you can't really say that you have one. We have examples that have come in just reporting yesterday that we can have the bed and we can tick off the numbers. But if they're not functional, they're not helping lives, they're not saving lives. So we have nothing. And I think that's the situation.
Which brings me back to that question I was asking. So if in the last 1 year we have had all this conversation, let's hire 1,000 healthcare workers. Let's increase the amount of money that we are channeling towards the counties so that they can prepare better. What happened, Dr. Mutua, in terms of, if you can see, Nandi County, for example, there is a report on the Standard yesterday was saying that Nandi County MCAs were saying we have the beds, but we don't have the personnel.
I think it's a challenge across the board, and it's not just about bringing in the personnel, because if you look at how many ICU nurses are out there unemployed in this country today, I mean, they are basically 0, because all the nurses that we have who are ICU are actually employed. We are actually now training more so that they could be employed into the national service for healthcare. So it's a challenge across the board. Provision of health services is very expensive. It's not just an issue of just having the person there. There is what you call recurrent budget. For example, in my budget of 12.5 to 13 billion, 50% of that budget goes to healthcare. You have to provide gloves, you have to provide medicines, you have to provide salaries to health workers, you have to provide benefits to health workers, you have to provide all these items, infrastructure to provide healthcare. So my budget, 50% are on healthcare. 50% now is supposed to do the other things, provide water, do all these things that now remove people from going to hospital, provide good roads, provide security, provide markets, provide schools, So healthcare is a very expensive venture, and that is why the insurance companies also come in and they make a lot of money from healthcare because, it's something you can't do without. So even as we criticize what has not happened, we have to be realistic in terms of the cost of healthcare and what has been done. I have done my part in Machakos. We can do, and we are still doing more. As we speak right now, I have construction going on of extra wards. I have construction going on of extra ICU beds. I have construction going on. We are employing more doctors in Machakos. I have employed more nurses than any other county in Kenya. Extra nurses. I employed at one time over close to 1,000 new nurses than what I found. So I have done my part, but can I afford it? It's becoming impossible to afford it because the general problem we have in this country is a low-income country where the economy is basically struggling. We don't have money in circulation. We are a country of bureaucracy. We are a country whereby our president said we lose 2 billion a day to corruption. And this is not corruption by people coming in from Uganda or Tanzania and Rwanda stealing from us. These are people who are close to him. As we say, Kikulacho Kingoni Mwako. This is a challenge we face as a country, and it's a challenge of this is where we are. Our politics are very bad. We employ the wrong type of leaders because we don't look at the ability of a leader. We look at how big the Kitambi is and what tribe they come from and who their father or mother was. We don't look at persons with ideas and love for this country, and therein lies our problems.
Dr. Mutua, when you tweeted this yesterday about saying the level 5 hospitals, 15 ICU beds, and the additional 12 HDU beds, totaling 27, were full because of severe COVID patients, a number of reactions came in, and some of them are some doctors who've worked in Machakos County. One of them said those statistics are false. Machakos level 5 hospital has 5 ICU beds and 11 isolation beds. What do you respond to this?
Those are people who are not in Machakos. Let one of them go to Machakos right now with a video camera on live and wear PPEs and walk around and count the beds. So this minimalistic view of people just criticizing, they can go to hell for all they care, because we are talking about lives here. We have revamped up, so they can go and count the beds and the people, the ventilators that are working right now, the HDU, the oxygen points, and they're there. And my doctors know that, my nurses know that. So we had 6 before COVID, and so we've been able to revamp up.
All right. Dr. Mutua, as we conclude the conversation this morning with you, pass on the message again to the country on what is happening in this third wave of COVID-19 and what we need to be preparing ourselves for.
There are 2 realities. The reality one is that it comes back to prevention. We need to go back to the protocols we had before. We need to mask up. Statistics have shown, or research has shown, if a society, 75% of a certain subculture masks up, then you flatten the curve. We also need to wash our hands and follow the protocols. If you look internationally, the main place for COVID transmission is bars, places where people are drinking. You drink alcohol and you can have your fun, you can drink alcohol, but bars are a major problem all over the world, followed by gyms. You go to gyms, you're sweating, you're exhaling, you have COVID, it just remains there. The next person comes, you cannot sanitize enough if people have really expelled so much, of the virus around that atmosphere. The third one is religious centers, churches, mosques, religious meetings. You see what happens in South Korea, The fourth ones are these public meetings and gatherings that are indoors. So we already know, science has told us exactly what to avoid. So we may need to go back to those protocols. It may hurt us, but for 3 weeks or 1 month, you can say, let's shut down A, B, C, D. Let's go back. Let's squeeze, and let's see how the curfew can be reworked in a way that people go home and stay home for about a month. We flatten the curve. We stop having more people coming to ICUs, because my doctors are calling me all the time. They are worried because ICUs are full. People are calling them. Can we bring up patients? We need oxygen. We need all these things. And we're in a situation where you hear somebody has died from COVID, and basically you follow it up, it's because they couldn't get a bed to get a ventilator. And that's just the reality, because the beds are taken, and you cannot remove somebody who is alive to bring in somebody, say this one looks like, we don't want to go to what happened in, was it in the US or Italy, where they had to decide whether, where they had to decide, in LA. In LA, we had to decide whether to take you to hospital or not, depending on whether you're going to survive or not. So they think if you're going to die, they don't put you on a ventilator. They put somebody who looks like they're going to live. We don't want to get to that stage. Number 2, and finally, is that this virus is killing men more than women all over the world, but especially in Africa and in Kenya. We talk to the hospitals all over the country. You find that 9 out of 10, 8 out of 10 of the patients in ICU are men. The mortality rate is higher on men. And it's not older men. It's men from the age of 30 going upwards. And this is because of social habits of men. If you have social scientists, they're talking about the meeting in bars. You're not feeling well, you're feeling feverish, your friends tell you, kuja to sanitize. Mpatie hii hapa, wacha sanitize. We've got that laissez-faire culture, and a lot of young men are dying. The women, for some reason, either have a high immunity, but I think women tend to be wiser and smarter than men when it comes to issues of health. They're taking care of themselves. They're not being reckless as men are. So it's something for us to be able to monitor and asking my fellow men. We have so much working against us. The pressures of society, provision, everything taking our families. Let's not go that way. And go. And finally is this. People are saying, well, I'm young, I'm healthy, Mimi Sakwa ICU and all that. Yes, you may not end up in ICU. You may not end up being sick because you think you're young and healthy and robust and everything. But you may kill others. And that's what it comes down to. Yes, you're a carrier. You have COVID. You're hanging out in these clubs. You're not masking up. You're being macho. You're hanging out with your friends. You're throwing house parties. You're throwing birthday parties because, hey, after all, you have to have a birthday party. Yes, you're killing others. You may not die yourself, but you're killing somebody's parent down the line. You're killing somebody's grandparent. You're killing somebody's father who is dying and leaving their daughter who you think you're a cool macho man you can date. You're
That's
killing
true.
others. You're a killer, by being reckless. So we need to also, for men, we need to man up and realize that we have a responsibility in making sure that our loved ones, whether we know them or we don't know them, actually stay alive and you're not transmitting this virus.
Dr. Alfred Mutua, asante sana for speaking to us. Dr. Alfred Mutua is the governor of Machakos County. Have a lovely day, sir.
Asante sana. God bless you.
Thank you.